My dear friends, welcome back to Alpha Physio Pelvic Care, all things pelvic health. If you're watching this video for the first time, my name is Anastasia and I'm pelvic floor physiotherapist with over 10 years experience practicing in the sunny Cyprus and also online. Today I would like to talk about use of TENS machine for overactive bladder. There is certain therapies within scope of physiotherapy, so-called toolbox of physios, that can be used. One of them is the so-called tibial nerve stimulation and sacral nerve stimulation. And today I will show you both and I will show you using particularly TENS. Before we continue, I would really appreciate if you drop a like to this video. Let me know in the comments if this is something that you have tried for overactive bladder or heard about or you were offered, or this is something you hear for the first time, or generally share your experience and questions in the comment section. What is TENS? TENS stands for transcutaneous electrical neural stimulation. And what it does, in particular case of overactive bladder, it stimulates the nerves that actually are supplying the bladder muscle, the detrusor, the fancy word for it, because bladder is a muscle. It is muscle we don't control ourselves consciously. It's under automatic control. And we can influence those nerves. We can kind of calm them down through the influence of the electricity current that is provided by a machine, and we can use it either on the tibial nerve, on the leg here, or sacral nerve, the nerves that are sitting here around your sacral plexus. Okay, so this is lower part, the sacral one, so around this area. Focusing particularly on the TENS machines. There are two ways you can do say a tibial nerve stimulation, than one around your leg. You can do it through a needle that you place near the tibial nerve, and you attach it to the TENS machine with the special clips, and then the machine sends the nerves through the needle into the tibial nerve that goes all the way up, and again influences the nerves around your sacrum that are supplying your bladder. This therapy works quite well. Some research shows up to 80% of success after 6 weeks plus treatment. The bit of the downside is if you use needles, you have to go to practitioner that can apply these needles safely, remove them safely. So that means time, money, and so on. And there are ways you can also do it yourself safely when trained properly. And you can do it at home with a TENS machine. Your TENS machine that you probably will see in some other videos I have. This one is particularly designed for birth. The design for birth is, it is very simple to use. It has just a few buttons, press, turn it off, and that's it. It has 4 settings, which is burst and boost. 1, burst, boost 2. So the burst wave goes like large, up and down, on and off. The boost is fast and continuous. Okay, so we probably want the fast and continuous one. However, it does really depend on your feeling, perception, and how you feel it, and you can try both. The stimulation will happen in any case, and it's a very safe therapy to try, and the worst thing that can happen is you will get no effect. Most people do get some positive effects, and of course if you by any chance feel worse, it's very fast reversible, so you stop stimulating and that's it. Okay, and you don't have these urges anymore. So it works long term. When you apply it long term, it's a cumulative effect. The protocol, before I show you how to use it, the protocol of usage is, though, you will have to commit to a bit of time. The good thing is, if you use the TENS machine with the stickers, unlike the ones with the needles where you have to be still for 30 minutes and you have to wait for the therapy to happen, with this machine you can move around if necessary. All right, it's good always to kind of lay down and relax and focus on your body when you use it, but if you need to move around, you can, because you can put this machine on your neck, apply it. And this is quite often quite encouraging for my clients, because they might be very busy people. It can be both male and female, working. You know, it's difficult for them to find half an hour in the beginning 3 times a week, 5 to 3 times even. Some protocols say I'll usually give 3 times a week for 6 weeks, and then the recurrent sessions are more spread out. And it's quite encouraging for them, the fact that they can move around, or they just can apply the machine and just put it in the pocket, hang it on their neck and work, for example, type on their computer, and so on. We're talking about tibial nerve stimulation. It's fairly easy. This is your malleoli, the fancy word for this bone here, and you place it around this area here. Now I have a very big stickers, okay? This will cover the whole area. You don't need as big stickers. You can take a small ones, twice smaller. I couldn't find the tiniest ones. All right, so this is like really big coverage in here, and technically you can use it. The most important thing is, when you start the machine, you shouldn't be seeing muscle twitching, okay? You shouldn't be pulling your leg into some kind of cramp and twitch. We don't want this muscle contraction. We want only enough signal to influence the nerve, but not enough tension and pressure to stimulate the muscle, okay? And this is, you can check it either with your healthcare provider, or if you do it yourself, to make sure when you start to turn on the machine, it doesn't pull you into the cramp. This is too much. We just need that buzzing feeling, but that's it. But on your leg, maybe it's going to be a little harder to move around, but you still can sit and work on your computer, watch some series, and so on. This is for the tibial nerve stimulation. You can also do this straight away onto the sacral plexus, okay? For whatever reason, you can, oh my God, this is so sticky. For whatever reason, you can't put it on your leg. And maybe you're a guy and you have a lot of hair, or maybe you're a lady who has a hair, or, you know, for whatever reason, you can't put it on your leg. You can go and put it around your sacral plexus. And the easiest way to explain it is basically your bottom crack. Excuse my super professional language, but the easiest way to explain. Okay, so this is your kind of bottom cheek, and around this area you place the electrodes here. So it's not very high. We need 2, 3, 4, S2, 3, 4, so it's around this area. And if I use my model here, so it's gonna be here and here. So if you look at it, right, it will be across the pelvic area where your bladder sits, and it will deliver signals straight to the sacrum. You see both ways of stimulating, through tibial nerve and through sacral nerve. Sacral quite often is used with the stickers, although you can use needles as well. Tibial I see way more with needles, but again, you can use the sticker. As I said, it will need some patience from you for at least 6 weeks. Usually they say 6 to 8 weeks, between 5 to 3 times a week for half an hour. It needs some time. The stimulation needs some time to settle in. And of course, I'd really highly recommend it to do under supervision or in a contact with a healthcare professional who knows about it. Usually it's pelvic floor physio or any other specialist, or on urge incontinence if they're using this kind of modalities, just to be in contact with them and to see how it works. It does not contradict any other treatments you might have for urge incontinence, overactive bladder, whether it's medication, some kind of relaxation techniques, exercises. They are not contraindicating each other. You don't want to stop one and start another one unless you really want to see what exactly is working. Okay, then you might want to say, okay, I'm doing only this now, I'm stopping this, I'm doing the pills, let's say, for example. Otherwise, you can interact with these. The only contraindications would be loss of sensation. If for any reasons you don't have sensation, you have to have good skin sensation, all right? You have to have full sensation. For whatever reason you don't have skin sensation, this should be a contraindication. Then you can choose maybe on your leg instead of sacrum. vice versa, but you have to have full sensation. Pregnancy, just because we don't know about safety of it, better not, better wait until you deliver your baby. And maybe some other specific conditions you might have. Usually TENS is quite safe. It's even safe for pacemakers because it's also far away from your heart, but you can double check again with your doctors. I know that TENS machines were applied with a pacemaker, but you can always check your case because it's relatively far away and it's very low output we want. All right, so yeah, this is your use of TENS machine for overactive bladder. Make sure you check my video on what is urgent continence, overactive bladder, so you understand the difference, you understand why we're doing what we're doing and why things work in certain type of incontinence and doesn't work in a certain other type of incontinence. And we will see you back very, very soon. Bye.